Let's begin our Myofunctional Therapy Self-Assessment. First thing on the list is oral posture. If you don't yet have a form to follow along, click the link below, enter your email address, and a full myofunctional therapy assessment form will be emailed to you so that you can follow along as you click through each video. Now, under oral posture, there are 4 items, and we're going to talk about what ideal oral posture is. When I talk about ideal oral posture, I'm talking about where your mouth is at rest. So when you're watching this video, when you're getting lost in your work, if you're doing this assessment on your child, it's when they are doing their homework or when they're playing with a toy in front of them. It is your go-to resting posture of your tongue and your lips and your facial muscles. First thing on our list is lip seal. Now, this is a very easy one to assess because we're starting from the outside before we even go inside the mouth. When I brought attention to your lips, I want you to note where they were. Ideally, we want the lips sealed. A nice, comfortable seal that does not take a lot of effort. Okay, if your lips were already there and you know that they're typically sealed and comfortable throughout the day, then go ahead and write WNL on your form and move on to the next part of the assessment. If your lips or your child's lips were not sealed, then let's talk more about how to look into that. So look at yourself in a mirror and go ahead and seal your lips. Let's look to see if there's any sign of strain in just a typical lip seal. Now, you might see that there's some dimpling at the bottom of your chin. This area, there's a muscle called your mentalis. And if a mentalis is working really hard to get your lips closed, then you'll see some dimpling. So that's one option that we could see. And then you might notice that your upper lip or your lower lip feel like they're straining, or they're kind of short and tight, and that makes it a little bit difficult to seal your lips. One other thing in this realm is that you might notice that your front teeth are slightly angled forward and out. And what that could do is actually create a longer distance for your lips to reach each other. So it might feel like your upper lip can't really, or is having a hard time reaching your bottom lip because of those front teeth. All of those things are important to note on the comments section as we go through this. Now, let's talk a little bit more about whether it's habitual or structural. It's not always one or the other, but sometimes it sways a lot more in one direction than the other. If your lips were open while you brought attention to them, and then you tried to seal them, and you looked in the mirror and there weren't really any signs of strain, your mentalis was relaxed, lips felt like they could reach each other, no problem, then potentially we're dealing with just a habitual issue, and it's most likely that it's easier to fix than if it were a structural issue. So if it were a structural issue, we might be dealing with, we talked about teeth position, but there's also other structural issues that could cause this difficulty in sealing lips. One of those could be difficulty breathing through your nose, right? So if you're not gonna seal your lips throughout the day if you're not getting enough air through your nose. So we'll go more in depth with that on a further part of the assessment, but just note the details of what you just found out from this section. And if you have any questions or comments, please leave a note below in the comments section or find me at my website at summerspt.com. I'd be happy to help.